In terms of people who are leaving employer insurance, I did see one poll tonight in Gallup. Fewer U.S. adults, 26 to 64, are getting health insurance from an employer in 2012, a downward movement since 2008. Now, it's down from 56.7 to 55.9. Downward,
and I can verify it's absolutely true, because I was on the phone yesterday with an employer with 400 employees. Another one had 250. Everything is changing after this health care law passed. They're scared to death. They said, I can't afford to pay this. I'm paying the fine, which means I hate this. My employees now are going to lose health insurance. Employers don't want to drop it, but if you have a policy that's going to cost $20,000 a year for a family, you can't do it anymore.
Are the people, though, who are the employees who are losing the employer health insurance, they will then go to the exchanges, right?
They have to go and buy a policy in the private market. I'm a federal...
Will it be more expensive than what they had?
Far more. I'm a federal tax lawyer. This is how it's going to work. Today, if you have health care from your employer, it's tax-free to you. You pay no taxes. Now when you have to go to these health care exchanges, you have to use after-tax money. The average family policy, Greta, is expected to be $20,000. I'm going to take $20,000 in after-tax income and go buy an expensive policy that government forces me to buy. I don't have a choice. It's like, here's your option on the menu, one choice, and that's what you get. This is not we have never had health care like this before. That's why I know people are going to come out this November, and they're going to vote for people who are going to really bring down the cost of health care. Barack Obama said he'd bring it down $2,500 per household. Instead, we went up about that amount. He's off by $5,000 per household. I don't know about you, but for people in Minnesota to have a $5,000 increase in what you pay on health insurance today over what the president said, that's not going very well.
What happens to the people in this Medicaid expansion? There are a number of states, Florida, Texas, and a few others, who say that they are not going to expand their Medicaid. So the people, instead of using Medicaid and getting like hospitalization, let's say they're in a very bad car accident and they end up at the hospital, is it now the doctors in the hospital who pay? Because they're not going to get turned away. I mean, somebody's paying. Who's paying?
Well, Medicaid that's available now will still be there.
But
I'm talking about
the ones the expansion. But the people who are in this window, there's 133% of
if you make 133% above poverty.
Right. Those people, the thinking under the Obamacare is that they would be covered by Medicaid expansion, right?
But remember, it isn't that all those people don't have health insurance now. A great number of those people already have health insurance.
I'm curious about the ones who don't.
Right.
And the ones who don't have this expanded because they're in the states that won't expand, they end up in a serious car accident and show up at the hospital. Someone is going to pay it somehow. Are the wrestlers going to pay in higher premiums somewhere, or are the hospitals going to pay for it? Somebody's got to pay for that. That's not free.
That example that's given is the one that the president always continues to give.
What's the answer, though?
That's such a tiny percentage. The answer is to bring down the price of health care. The more government intervention we have, the higher the price of health care. Three simple things we can do. Let anyone buy any health insurance policy they want anywhere, no minimum federal requirement, tax-free money, have true medical malpractice reform. Everybody wins on that. That doesn't cost taxpayers a dime to do that.
No, but is it going to cost the hospitals and the doctors have to do it free? I'm just trying to figure out who's paying for it.
Listen, somebody is going to be paying. The problem is, every time the federal government gets involved, the costs skyrocket, and it will be far more expensive. You see, that's the bottom line with the president's health care plan, Greta. We pay a lot more. We get a lot less.
Well, don't start me on government waste. There's $14 billion that we reported on Monday in overpayments in unemployment benefits.
It's a disaster. That's got to stop.
There's so much waste and fraud.
And a government-run health care system won't be fraught with waste? Are you kidding me?
Anyway.
I've got swampland to sell you, Greta.
Indeed. Anyway, Congresswoman, thank you.
Thank you.